Dr. White, are the economic projections provided by the Congressional Budget Office concerning Obamacare paying for itself in 10 years contingent on a certain number of people signing up? What happens if they don't? And the related question then is, where is that money coming from to pay it off in 10 years? You have 2 minutes.
Yeah, I think the premise of the Obamacare system is that you're enlarging the risk pool. As soon as you say you can't kick people off the rolls for pre-existing conditions, then you're going to have to spread the risk around. And that usually, in this case, it means that young people need to get on to the healthcare rolls. I think this is, I guess I'm just a liberal because I'm optimistic and hopeful in this regard. Part of Obamacare has, it allows people to stay on their parents' health care for 26 years until they're 26. So there's already a certain tradition or habit formed in the individual of having health care up to 26, and then at 27, I don't think it's likely that people are going to say, I don't want what I used to have, I'm going to want that. Good news for Republicans is that more young Republicans are signing in. So when it comes to personal responsibility and saying that I'm going to get coverage so that I don't become a burden on society when I'm not able to pay my way if something catastrophic happens, young Republicans are signing up more than young Democrats, and that's something that needs to be solved.
1 minute.
When it comes to getting people into the pool and getting them quickly, if we look at what happened in Massachusetts, I think that's instructive. There was not a smooth rollout. It was not quite as rough. I will certainly concede that. But it was not perfectly smooth in Massachusetts at the beginning. And what did people do? Well, they did what human nature tends to do. They procrastinated until the end. So this is November of 2013. People have until, I think it's March of 2014 to sign up. So we have a long ways to go in terms of waiting to see if we're going to get the sufficient numbers signed into the pool. And I'm optimistic that between now and then we can fix a website and we can get the message out that people need to sign up.
Thank you.
Well, needless to say, I'm not optimistic. I don't really see why young people will sign up. I mean, really, you say they're in the habit, but you know, young people don't always have a lot of money. And when the choice is between buying health care and buying a car, I think a larger percentage of them will buy a car. I think that their attitude is, you know, I'm young, I'm healthy, I'm bulletproof, I don't really need this. And oh, by the way, the Obamacare law is written such that if they have a medical crisis, they can sign up then. So if they're rational, why would they throw their money away? Just out of sheer altruism? I mean, quite frankly, I don't see it in my students. And I can say if I were in my 20s, I sure as heck wouldn't be signing up. But you know what's even worse? Because the expenses are going up so high on folks who had their own policies, larger numbers of them are going to be electing to go without insurance. And here is going to be the most important irony. In the end, we may have more uninsured because of Obamacare than insured. Instead of getting rid of the uninsured, there may be millions more. Even the Congressional Budget Office is projecting that, oh, by the way, 30 million will still be uninsured. You know, in the run-up to Obamacare, one of the groups that was labeled uninsured were folks who were in fact eligible for Medicaid. They had just never signed up for it. If they didn't sign up then, why are they going to sign up now? And I know the ones who are going to sign up, the ones who are sick and need lots and lots of money. And where's that money coming from if people are not altruistically pouring it in just in order to make Obama happy?
Thank you. Dr. White, you have 1 minute.
I think if we operate from the premise of self-interest that people will sign up, because the teeth of the Affordable Care Act is that it's a tax, so that if people do not sign up, then they would be liable for a tax which is capped at the cost of what is so-called bronze plan, which is the minimum plan that people are required to buy in the marketplace or the insurance exchange marketplace or plan. So I think if you're a young person and you're thinking I'm bulletproof, you're gonna still sign up, because if you don't, you'll be taxed for the price
30 seconds.
What you would have to pay if you did sign up. And wouldn't you rather pay the same amount plus get the health coverage as opposed to not paying it and then being personally liable for all the healthcare costs? Because that's the consequence of not signing up in the exchange program, is that you will be personally liable for $30,000 on average for a hospital visit, $7,500 for a broken leg. These are not costs that the average American can just cover unexpectedly.
Thank you. I'm going to try to combine several questions here because there are a number of them, and I think rightly so. Individuals, I've got a number of cases here, my premium went up like this, or it came down here, I'm not sure what coverage, and so on. So we'll start with Dr. Fein on this one, and maybe sort of, if you can pull these together in a way. Part of it relates to the question also that if young people are supposed to sign up, and in large part that's going to be less risk and therefore lower the cost. But we have a situation today where unemployment is very high, particularly among those young people. We've got a bit of a tension there. So back to the affordability or the sustainability of the plan, but also the questions, the individual concerns that are out here about what information they have now about how their plans are changing, and the ones obviously that come in the most are my premiums are going up. What can you say to them? And we'll start with Dr. Fein. 2 minutes.
Okay, first of all, I got to address something that Dr. White said. We know that there is a tax if you don't sign up for Obamacare. We know that it's very low tax initially. What Dr. White is telling us is that that tax increases over time, and that eventually when it gets to substantial height, then young people will say, gee, now's the time. But you know, that's a bunch of years from now. And you know what's going to happen in the interim? People are going to notice that their taxes are going up. And you know, we still have a democracy. And people are going to take their grievances to the polls. And people are going to, and those people who are in the upper middle class, and I'm going back to that, these are the folks who are most aware of what they are going to have to spend, and they're going to have the greatest grievance. And these are the most articulate people, the most influential people in our society. These are the people that the Democratic Party cannot afford to lose. Now, I can't predict the future. I really don't know exactly what's going to happen in terms of costs. We can project from the present, and that's not very sustaining. It doesn't give us much hope for what's likely to happen. But I don't think we're going to get there. I think that there's going to be an awful lot of pain before that, and people are going to make changes. And I think that among those who are going to make the changes are going to be endangered Democrats. Obama's not endangered. He's got his second term, and he can keep it. He may be ineffective, but he's going to be president for another 3 years. A whole bunch of folks in the Senate, no, that's not true of them. A whole bunch of folks in the House of Representatives, wait and see. If there is a huge earthquake in terms of voting patterns, something will happen. It may not happen in 14, but if it doesn't happen in 14, something is going to happen in 16. If it doesn't, then we as a nation are headed toward mass poverty. The notion that the United States is going to be the preeminent world power forever and ever, that's nonsense.
Thank you, Dr. Fein.
Sorry.
Thank you. Dr. White, 2 minutes.
Okay, so I think the question is about premiums going up. And there have been reports where people are seeing their premiums rise. and then can't get on the website and see if they're eligible for subsidies or cheaper plans. And that's a problem, obviously, politically, optically, but also practically, because people are concerned about having coverage. So I think it's too soon to put a period on the story and write the end, because I'm assuming the website will get fixed, and then the question will be whether or not an individual who's seeing their premiums rise right now will be eligible for a subsidy that can actually end up offsetting their costs and yielding a net win for them, so they're paying less. Other questions I would ask is, are they going up more than they were going up before? You know, it was common for insurance plans to rise double digits every single year. And if an individual is in a situation where they are unemployed or they can't afford health care, the law, it provides for that situation for an individual who for some reason wants to take the risk of not having coverage. There are ways in which to be exempt from the tax for hardships or for other reasons, so that they wouldn't be further burdened with the healthcare cost. But I think on the main, my assumption is that most people will pay less. They will have better coverage. The plans might have been dropped because they weren't having a sort of minimum catastrophic care that you're now having, and so you're paying a little bit more, but you're getting more, whereas you wouldn't have had enough with the sort of cut rate insurance from before.
Thank you. And Dr. Fein, you have 1 minute.
One thing I'm very confident of: the middle class will pay more, the poor will pay less. That's what's happening now. And all this talk about subsidies, well, you say subsidies, everybody gets a subsidy, but the subsidies for the middle classes are trivial. They don't offset the costs at all. And oh, by the way, the poor who are getting these extra frills and what have you are not going to be taking advantage of them the way that middle class folks would. You know, we have social class differences in this country. We like to pretend, or certainly the
30
liberals
seconds.
like to pretend, that we're all equal and one day we will all be equal. But in point of fact, we are not equal, and we don't handle our problems in the same ways. And whatever happens with costs, middle classes are going to handle things better than the poor. That's not nice. That's not fair. That causes pain to people. It is a fact of human life. Liberals want to eliminate all inequality. That is a pipe dream. And in the effort to do so, they continuously make things worse. What's going to happen with costs? We'll see.
Thank you, Dr. Fein. We have a couple of questions, and I'm going to ask our participants, given the time of the evening, to make closing statements. And if I may, I'll just throw out a couple of things here that come from the audience that may or may not fit into what your closing remarks would be, so you do not have to answer them, but I will, as a representative of the audience, try to pull these together. The question of who will carry costs when people choose to pay the fine rather than to buy insurance, I guess in 2014. In 2016, when the full fines are implemented, what special interest groups, I like the tone underlying this, what special interest groups will get passes to ensure future votes? And another question related to that is, we've had some doubts expressed on both sides about the ability of our Congress to come to grips either with the creation of this plan or with an alternative that would actually work. What would you have to say about that? And the wrap-up question that maybe you can use that as the umbrella in these remarks is, what is the long-term future of Obamacare, and what would you leave our audience with this evening to ponder? And I believe we are scheduled to start with Dr. White.
Well, so in closing, thank you all for being here again and being part of this conversation and making it to the end. Your effort is not unnoticed. you know, the status quo is unacceptable in terms of the pre-Obamacare situation. That's just not sustainable, and I think that there's consensus on that point, so something had to be done. And so Obama put forth a plan that relies on the existing insurance market. I think that's a moderate plan. It is not what the liberal would want, which is single payer. It is, in essence, the heritage plan. It's, I think, Bob Dole's plan from the 90s, by and large, and it emphasizes personal responsibility. So I find myself in a weird situation where I'm defending something that I think is at its core what we would have called conservative, because it's not giving people health care, it's asking people to pay for their own health care. There's something that we haven't addressed here yet, which is something I'd like to bring up. I think is actually kind of interesting and exciting, and that's this idea of no longer possibly being tied to insurance, to employer-provided insurance. You know, from a conservative point of view, if we value competition and the marketplace, then how exciting is it for individuals to be able to get their own insurance plans and be able to become entrepreneurs if that's what they want. And if the only reason they're staying at their job is because of healthcare benefits, then the economy is suffering. It's losing that creativity. So here's an opportunity for people to be self-insured entrepreneurs and leave an existing employer if that's not where they think their talents are best spent, and to go out and create that new gadget or provide that new service and have that sense of security that they and their loved ones will still have health care coverage because they're the ones who are in the position that are providing it for themselves and for others.
Thank you.
What I'm hearing are pipe dreams. I'm hearing hopes to trumping reality. The poor are now going to go out and start businesses. Please. It's not what's happening. It's not what's ever happened. Okay? And the poor are paying, no, they're paying less. They're becoming more dependent, not less dependent. They are not becoming independent. We are not encouraging independence at all. Worse, we're not encouraging honesty. This whole plan has been rolled out, wrapped up in all kinds of lies and misstatements and emotional appeals and all kinds of stuff to not deal with the reality. People got called names. People are imputed motives that are not real. The media protects the lies and doesn't expose them. The United States is becoming a nation in which telling lies is acceptable. My students say it over and over again. Everyone lies and everyone cheats. In a mass society with over 315 million of us, we cannot survive without trust. And Obama and Obamacare are undermining our trust in one another and in government. This is a disaster. It's not a temporary problem, it's a huge problem. And oh, by the way, if we don't speak up against dishonesty, we are enabling dishonesty. If you don't get angry when people lie to you, if you make excuses when they lie to you, you get more and more lies. And in the end, people cannot tell the difference between what is true and what is not true. This is more important even than healthcare, because if we lose this interpersonal trust, our society will collapse and there will be no money for anything, including healthcare. We will become a second-rate power. We will be at the mercy of all kinds of bad actors out there in the world. You know, not everybody in this world wishes us well. And if we don't take care of business and keep our nation strong and deal with the realities that we must deal with as adults, then we are going to get what we deserve. And, you know, I tremble at the thought. I'm getting up in a few years. I hope I've got a bunch of decades left in me, but I do fear for the children and for the grandchildren and for the great-grandchildren, because this is a game led by Obamacare, that we cannot afford to play. We must start calling it out. We must be willing to say Obamacare is a lie. The promises are lies. The consequences are lies. We must look at the negative things. People are losing their jobs. The president says, no, they're not. Well, they are. Okay? The
Dr. Fein, I'm going to have to call time. Thank you.
Wrong. Come on.
Has nothing to do with right and wrong. But always, if you know Mel, he'll always understate things and never tell you what he really thinks. I really want to thank our two debaters, and I will say Ken, Mel, thank you.